Hi, my name's Mr. Jeremy Weech. I'm a consultant gynaecologist at Mid Cheshire Hospitals. I'm going to talk about pelvic organ prolapse today. Pelvic organ prolapse is really common, unfortunately. Probably about 1 in 10 women will have symptoms of pelvic organ prolapse in their life, but probably about half women in their lifetime will actually have pelvic organ prolapse. So what is it? It's when one of the pelvic organs, so that's your bladder, or your uterus, or your womb, or your rectum, or bits of the bowel, start to fall into the vagina. As I said, it's extremely common. The bladder, when it falls down, we call a cystocele, and when the rectum falls forward, we call it a rectocele. So what causes prolapse? Well, there are lots of reasons that might cause prolapse, but we have to understand what's going on. Essentially, the tissue between the vagina and the bladder and the bowel and the uterus is soft tissue. There's no bones there, so it's collagen, which holds things in place. And what happens is that collagen becomes weaker and doesn't support the structures as well as they should. And so things can begin to fall. Perhaps during childbirth, that collagen gets damaged, for example, and it repairs itself after childbirth, but then as time goes on, it becomes weaker. It's lost some of its tensile strength, so things begin to fall. So that can be made worse by being slightly overweight. That just means that more pressure is going through the pelvis, which will increase the chance of pelvic organ prolapse. You may have chronic constipation. So if you're having problems with constipation and you're bearing down a lot on the pelvis, that's going to increase your pressure going through the pelvis and increase the chance of developing a prolapse. You may have a manual work, so you've done lots of heavy lifting, and again that would mean over the course of time a lot more pressure going through the pelvis, which results in more chance of you developing a prolapse. But also it just may be that you're just life itself, living on two feet and getting on with life can just lead to the problems that you may have now. So how will you know whether you have a prolapse? Well, the most common thing I see in clinic is a woman is in the shower, in the bath, and she feels and you go, oh goodness, there's a lump down below. And it can be scary. People don't like it's worrying about what it is. The good thing is that prolapse is apart from symptoms, is not life-threatening, but it certainly is life-affecting. And the way it affects you will be dependent on what is coming down. So, for example, if the bladder is falling down and the bladder is below where you normally wee from, you may have difficulty with your going for a wee. So you may not completely empty your bladder, and some women will need to move position when they're having a wee just to make sure they empty their bladder. But because they're not emptying their bladder very well, they may be more prone to getting urinary tract infections, for example. They may have a lump down below, which may be even the uterus or the cervix, the entrance to the womb, at the entrance of the womb, and that's uncomfortable. And especially during the day, if you're up on your feet all day and you're doing work, it will descend even further into the vagina and be quite uncomfortable. If it's the back wall of the vagina that's causing a problem, sometimes that can make it problematic to have your bowels open. For example, the poo just gets trapped behind the vagina, and some women need to press within their vagina to have their bowels open, for example. So all of those symptoms can be quite distressing, and when you have these symptoms, as I said, 1 in 2 women may have prolapse, but only 1 in 10 will have symptoms. But when those symptoms are there, you should come and seek some help. And the first person would be to come and speak to your practice nurse or your GP, and they will see you and perhaps refer you on. So treatment options, initially, we go back to what we were talking about, what the causes are. So first thing to do if you notice you have a prolapse, certainly thinking about weight loss would be really helpful, and certainly thinking about managing your constipation. Those two interventions will be a huge advantage. If you've passed the menopause, you may well benefit from some local estrogen, HRT, that we put into the vagina to help the tissues strengthen, because they become weaker after the menopause. To support the structures that are coming down, remember the bladder, the bowel and the uterus, you may well gain more support from your pelvic floor muscles. Now, your pelvic floor muscles are that hammock of muscles that lies underneath your pelvis. And by strengthening those muscles, you'll get much more support to the pelvis to support the structures. And that may be all you need just to make yourself feel more comfortable and to manage the prolapse. The pelvic floor muscle is both a quick-acting muscle and a long-acting muscle. So it's really important to both train your muscle to be quick-acting, so quick contractions, and some more sustained contractions to really build on the strength of those muscles. And by doing that, you'll support the pelvic organs. These interventions you can do for yourself, and very much encourage you to start those now if you're watching this video, and also to encourage your daughters and your granddaughters and anyone else, because pelvic health and the symptoms that are associated with pelvic floor dysfunction are really have huge quality of life issues. If you think about your bladder function, your bowel function, and your sexual function, things that people find really important in life. And managing your pelvic floor as a woman is incredibly important. So why might you come and see someone like me? Well, it may be that despite the interventions you have, that you still have symptoms, and so a referral to the hospital may be necessary. And at the hospital, I will take a history and we'll talk about we'll understand what symptoms are particularly affecting you, because it's really important to understand what symptoms are most important to you rather than what the prolapse is. Once I've understood that, then I will examine the vagina, and we use a speculum examination, just like when you have your smear test done. And I'll tell you what kind of prolapse you have, and then we can talk about possible interventions that we could do. Hopefully you'll have been doing your pelvic floor exercises. It may be that you may need some more directed pelvic floor education through physiotherapy. And any intervention that I do will be benefited. You'll get better results if you have strong pelvic floor muscles for everything to sit on from below. It may be that we try a pessary, which is a device that we can put in the vagina that supports the organs of the vagina. They come in different shapes and sizes and are individualized to the woman. And of course, there is always a surgical intervention that's potentially there. For example, if the womb is coming down, we may recommend a vaginal hysterectomy, removing the womb from below, and we may need to support the top of the vagina with an operation where we suture the top of the vagina to one of the ligaments of the pelvis. That's an operation called a sacrospinous fixation. We may want to support the bladder, and we can use some buttress stitches underneath the bladder to what we call an anterior repair, and a similar fashion to the back wall of the vagina, what we call a posterior repair. But as I say, surgery is really left for the cases that are not responding to the conservative measures that we've talked about before.